Hello, and welcome to another edition of Autism BC Talks. My name is Brock Shepard. I'm the program manager with Autism BC. And today we wanted to gather based on one question that was coming up a lot through our information requests that was an important issue for the autism community. And that was, how safe is it to take public transit when you are going to school, when you are going to work, for peoples with diverse abilities, people on the autism spectrum, and what is it that Translink is doing to make sure that we are safe. So today, we're lucky to be joined by Sarah Armstrong from the Canucks Autism Network, the Navigator of Youth and Adult Services, from Chris Chan, who is the Travel and Training Manager for Translink, and Jake Anthony, the Program Ambassador with Autism BC. Thank you all for joining us today.
Great to be here.
Sarah, why is it that you wanted to be part of this?
Yeah, so, at the Canucks Autism Network over the past few years, we've really become increasingly aware of the need to really diversify our programs and include more programming related to important transitions into adulthood. And an area that's really come up for quite a few of our members is transit. So, in 2018, 2019, CAN partnered with Translink to host 3 transit accessibility tours for youth and adults with autism. Participants had the chance to practice the steps of boarding the bus, general bus etiquette, with hands-on support from CAN staff and Translink operators. So, it was a great opportunity for individuals to gain confidence with trip planning and the whole travel routine, while potentially, coping with things such as sensory overload. So because of COVID-19, we're not currently able to offer this tour, but we're continuing to look for creative ways to offer programming in the future. So we're really thrilled to be able to, to have Chris here today to ensure individuals stay up to date with the most current information.
And those are great videos, and I know that we have shared them in the past, but we can probably link those in for people that haven't seen them to the side of this video, because I know that you have made those video resources.
Yeah, that would be fantastic.
Chris, could you let us know more about that and partnership that you have with Canucks and why you were willing to join us today?
So I'm happy to be here representing Translink. I actually work with the accessible transit team at Coast Mountain Bus, which operates the handy darts, so the paratransit side. The reason why it's important for us to have great partnership with organizations such as CAN and also Autism BC is because we have seen over the years increasing amounts of demand for accessible transit right here in Metro Vancouver. And transportation is not everything, but it's a small part that leads to a lot of openings. So once you start to be able to use the transportation system, you can go to different places. You can go to doctors to get the medical help you need. You can go to school to get the education you want to get. You can go to your job if you have a job that you like, or even just going to the park or going to the mall. It's opened up so many doors to a fuller life, and that's why it's very important that we actually provide the information for different different customers in the region, and actually everybody in the region. Because once you open that up, the region is yours to travel.
Yes, exactly. And it's like, it's such a important topic for all of the Autism BC membership, and I know the Canucks network as well. And it just opens up so many different possibilities. Somebody from our team, Jake Anthony, our program ambassador, he had been on like a Translink advisory board in the past. So I wanted him to be able to join this as well. Jake, could you let us know a little bit more about that and your experiences?
Sure. Well, for a couple of years, I think back between 2016 and 2018, I was with the Access Transit Users Advisory Committee, or the UAC, as it's known for short. And so it's great to be back here with working with Chris again, because he was a staff member on that committee. And you know, a big part of the work that we did there was really about trying to make you know, transit accessible for everybody. And so a big part of that, I mean, everything from curb cuts at bus stops to at Skytrains, making sure that elevators were operational, ensuring that whenever there was renovations or new installations of bus stops or new Skytrain stations put in, that they were accessible for not only people with developmental and physical challenges, but for people with sight loss, for people with hearing loss, you know, and even providing things like, you know, Braille in terms of the signage. So having, yeah, not just the signs up there with regular print, but also with Braille. So that was kind of my start. And actually, this you know, project that's being done was starting at that point when I was the chair of the committee back in 2018. So I'm really happy now with AutismBC as program ambassador to be able to kind of help out at the finish of that project, and to have been there at the start, and to get to be here and to work with Sarah and with Brock and with Chris to provide a tool that I think is very important to people on the spectrum. Because a big thing is that, you know, individuals, and I'm like this too, I like to know when I'm going on somewhere that I haven't been before, or that I'm not comfortable on, what am I going to see? You know, what's the experience going to be? And this tool is really a great tool for being able to really show, you know, to really be able to plan, okay, you know, when I get on the bus, this is where I put my card, or my Compass card, or my transfer. This is where I sit, you know, this is how much space that we have. And I mean, I think right now with COVID-19, I mean, you know, it's a lot of people are very anxious to ride the bus, and especially people on the spectrum who may not be comfortable or able, because of sensory sensitivity, to wear a mask. And so, you know, the importance of social distancing, you know, is still very important on the buses. Even though masks are mandatory, there's still some people who can't wear them. And I'm not just talking about people on the spectrum, but I'm talking about people with all kinds of different challenges. So, but I'm really happy to be here and to hear the questions, and to answer some if I can. So, thank you.
Yes, thank you. And I think you touched on a number of different things that will come up in the question period. With this talk, this is going to be a two-part talk. So first, we're going to have Chris be able to share a PowerPoint that Translink has put together that is using transit, the new normal. It is a short, pretty accessible PowerPoint. And I know you have a few videos that you'd like to share with us as well. And then we will open it up for a question period. If anyone has questions for Jake or Sarah or Chris, if you can type those into the chat box. If they're specific to a person, you can type them in and we will be able to ask those. But I will leave it to Chris now to have the presentation. Thank you.
Okay. I just want to double check. Can everybody see the presentation right now?
Yes.
Okay, awesome. So we are here to talk about using the transit system now under the new conditions. So I'm sure many of us have heard that there has been a lot of changes since the pandemic started in March. Some of us might have been on transit since, but a lot of us have not. And there must be a lot of questions we have, and we probably heard stories. Oh, I heard now we're boarding from the back of the bus, or we need to wear masks when we go on the bus. So today we'll answer quite a few of those questions. And of course, if you have any questions afterwards, please let us know, and we'll do our best to answer all of those questions. So there has been some changes, but what I would like to show you first is a little video that Translink made, it talks about what Translink has been doing to try to keep our transit system safe for our users and for the community, but also what you as a passenger can do to help us keep the system safe. I'm actually gonna switch over to another screen just so that we can have a look at that. Okay, so that was the quick video. So I know it was pretty short. Now we are actually going to talk about everything that is on the video, so in a little bit more detail. So don't worry if you missed any part of it, or if you have any questions about it, then we can talk about that a little bit later. So first, let us talk about what we are doing at Translink to show what we're doing at Translink to keep everybody safe. So, for example, on the Skytrain, we are doing more cleaning. For some customers that have been on Skytrain, you will notice that at some stations, usually very busy stations, there will be all of a sudden a team of several people come onto the train and they will start wiping everything down. These are what we call pit crews. It's kind of like a race car event where the car goes into the pit stop and a team of specialists just jump in, change everything, fix everything. It's kind of the same idea. So we have pit crews coming in to just clean the high use areas in the high use stations. So that way customers can continue to use the system safely and prevent the spread of the virus. Now, other than that, we are also limiting fare gates access. We're not shutting down gates, but what we're doing now is we're controlling the direction of the gates. The most common idea would be if you are going into a station, if you stay to the gates to the right-hand side of yourself, those gates will be going into the station. And the same thing when you come out, as you head out of the station, as you head toward the gates, approach on the right-hand side, those gates would most likely be the ones that you're using to go through. Now, there are some exceptions. There aren't that many of them, but there is a small number of them that one or two gates might be a little bit different, but most of the time it will be on your right hand side. So this way, why we are limiting the gate access is because, first of all, if you use the transit system before, gates, you could go in and out, but a lot of times you will run into people as you approach a gate. There might be somebody waiting on the other side of the gate, just going the same direction, and that will reduce your space for social distancing. So that's why we're doing that now. And it also allows us to control the flow of the station. Also, we can control the crowd inside the station a little bit better. There are also signs at the station to promote physical distancing. So there are little talkers on the floor. There are posters to remind everybody about physical distancing. So just follow those signs and they will probably provide for good information on where to stand and where to sit and where to wait for your Skytrain. On buses, we are also doing more cleaning on the buses. There are limiting capacity on buses in comparison as before. So it's not very likely that you will see a really crowded bus like before March, especially on some of the more busy routes. But now with that said, there has been some changes with the capacity of the buses. So at the height of the pandemic, so in the beginning of, in the mid-March until around June, there were very little seats on the bus that is available. They actually had certain seats taped off so that customers cannot sit on them to promote social distancing. That has, with the situation in BC and in Vancouver being slowly getting better and better, in June, they did reduce that limitation. So when you go on a bus now, if there is a seat, you can still go on the bus. But once all the seats are taken on the bus, they are deemed as full by the bus driver, and the bus driver will no longer pick up passenger along the way until passengers from the bus get off, disembark the bus. So that is our way of trying to promote social distancing. But I think it's also very, very good to note that just because you are sitting in a seat and yes, there's nobody standing, but somebody is probably sitting next to you. So if that's the case, we need to do our part in making sure we are safe and also our fellow passengers are safe. And we'll talk about how to do that. At some of the bus stops, you will also see signs to promote physical distancing. So kind of like at the Skytrain station, they will have signs to remind passengers to keep your distance, or keep the 2 meter or 6 feet distance between yourselves, and that way it keep everybody safe as well. Now, what can you do as a passenger or as a member of the community? So if, as the province health officials has always said, if you feel sick, if you it's not necessary that you have COVID, but if you feel sick or if you have some symptoms, stay home. Staying home, get rest up. That way, you will get better quickly, but it also prevents other members of the community from getting sick as well. Avoid touching your face when you, especially in public places, because some of the surfaces might not be as clean. So therefore, you try not to touch anything when you are in public places. Also, if possible, actually wash your hands frequently as much as you can, especially if you are ready to go eat something or drink something or touch something, some of your personal items. It's better to wash your hands, or where not possible, maybe bring hand sanitizers, like small vials hand sanitizers. That way you could keep your hands clean at all time as well. Now, when you go on transit, there are some tricks to it. So timing is key. So a lot of times is what we try to encourage our customers to do is, if possible, do not travel during busy hours. So when early in the morning, when everybody goes to work, or in the later part of the afternoon when everybody is just leaving work and heading home, or leaving the appointments and heading home for dinner, those are the time that we try not to use transit. Now, of course, if you have an appointment or have a meeting or have something you have to get to by a certain hours, then you don't really have that option. But if you are just going to the store to buy something, maybe wait until later in the morning, earlier part in the afternoon to go, as those times there will be less people on the buses. That will also allow for, first of all, more room for yourself to maintain the social distancing, but also it will also allow for space for those that essential workers that have to get to work. So doctors and nurses that have to get to the hospital because their shift is coming on. So that will allow them as well. And when you do, plan your trip using the trip planner, or give us a call at our customer information line at 604-953-3333. And when you plan your trip, I think right now it's very good to, well, keep this in mind, is plan extra time for travel. So we have always told everybody to, if you use, especially if you use the trip planner and it tells you that the bus is going to show up at 10 o'clock, do not show up at the bus stop at 10 o'clock, because sometimes the bus come a little bit earlier, sometimes the bus come a little bit later. So you always want to arrive a little bit ahead of time. But especially nowadays, if you are traveling, especially during busy hours, and you have to get somewhere by a certain time, we would strongly recommend you make extra time. Make one extra bus frequency time. So if the bus comes every 15 minutes, if your bus was going to come at 10, try to get there by 9:40. Maybe take the 9:45 bus. So that way you give yourself a little bit ahead of time. And if you get there a little bit early, then you get to relax a little bit and browse, have a look at what is available there. But if you're late, then you're late. So try not to do that. Now, there has also been a recent change since August 24th. Passengers now must wear a face coverings on transit vehicles. So when we talk about face coverings, it's not necessarily that it has to be a medical mask. It could just be any mask that you buy from the drugstores. It could be a cloth mask. It could be a piece of cloth or a scarf. It just covers your mouth and a little bit of your nose, so that it actually forms a protection. So the protection will help you from attracting the germs, but also from spreading it as well. Now, with that said, there are some customers that might not be able to wear masks because of some of the limitation. It could be that they have difficulty breathing when they're using a mask, or that it's just too restrictive for them. Now, with that said, what you can do is you can get what they call exemption card. So Translink has issued some exemption cards for those that request them, and you could pick them up at our Stadium Chinatown office, at the Compass office at Chinatown, or you could contact Translink and we could send you one. So when you have this card, when you go on transit, just show it to the driver, show it to the Skytrain attendant, and that way they know that you cannot wear a mask. But of course, we strongly recommend customers to please do wear the mask when they can. And only get the exemption when you really need it.
Chris, could you let us know what the best number to call for that is?
I think the best number to call would be 604-953-3333. That's our customer information line. They will arrange to have one sent to you.
Okay, thank you.
Okay. Now, other than that, what can you do? Of course, where possible, keep your physical distance from other passengers and transit staff. Now, when you go on the bus, that also changed a little bit. When you go on a bus now, when you approach the driver, there's now going to be a little barrier. There's going to be an invisible barrier You could still see the driver, you could still talk to the driver, but there's a little glass or a little plastic panel that separate between the drivers and the passengers. So that way, if the customers talk, they can still talk without the fear of spreading or attracting the germs. There also there are physical distancing markers on the buses and the trains and the stations as well. So please follow those. Now, but we did talk about earlier. So with buses, people are sitting together now. So sometimes physical distance is not necessarily possible. I think when you're a passenger, you need to do what you are comfortable with. So if you are not comfortable with sitting close to somebody, even with a mask on or even with a face covering on, you might have to plan your trip a little bit more ahead of time, or a little bit earlier or a little bit later. Or for example, if you're on a Skytrain and this Skytrain is just very full, maybe we'll wait for the next one. Hopefully the next one will have a little bit more space in it to allow for better physical distancing on them. Now, with that said, there are some stations that also have hand sanitizer dispensers. So they are really more movable ones. So they will put it out at the station, and if you see one of them, please help yourself. You can use those. Just get a squirt of hand sanitizers on your hand. Just rub it on your hands, and that way it helps keep your hands clean. And of course, as we talked about earlier, especially if you feel more comfortable with it, please bring a small bottle of hand sanitizer yourself as well. That way you could use it anytime you feel is necessary.
Chris, we had a question that just came in from Ethan here. Could you confirm why on the bus you don't need to be following those social distancing rules?
Well, it's not that they don't need to. So with public transit, I think part of the situation is they have to balance between capacity and also the health risk. So for example, on planes and on buses, they actually did have that. There wasn't really a requirement per se by law, but a lot of authority, a lot of transportation authority like ourselves and also the airlines, they actually put in the physical distancing, like the space in between the two seats before. But as the pandemic numbers have went down a bit, they start to relax those. But that's part of the importance why the mask was so important. So when you go on a plane, you are required to wear a mask. So as BC Ferries on a longer trip and on transit, we have now made that mandatory as well. So I think it depends on the different thinking. Some customers feel that I must have physical distancing, and some customers feel that as long as I have a mask, that will help me from attracting the virus as well. So physical distancing is no longer as important. So and I think the health authority and health officers have been discussing when you have one, do you need the other? But if possible, of course, do both. But where not possible, at least do one and not the other, and maybe not the other one. So in public transit, that's part of the problem, because there's no guarantee that you can have physical distance. So that's why it's very important to have a face coverings.
Nice, thank you. There was one more question, while I have you on the question time. There was a question that came in from Julie about the conditions or challenges. Is there a need to provide evidence to receive those exemption cards? Or how do you know what that process is when somebody calls in?
So at the moment, there is no medical verification, if that's what you're asking, Julie. So it's well, as we all know, in Canada, we operate under a society of trust. So basically, is if you need it, please contact us, and we will issue you one of those cards. But I think it's fair to say this as well. Um, the mask is not is go both ways. It protects yourself and also your fellow passengers. So I think it's where possible, please wear a mask. And of course, if you really have any restriction or any abilities that prevents you from wearing the mask, please get one of these cards. Uh, Translink is currently employing the educational model. So right now they are not penalizing passengers for not wearing a mask. We're on education process where we will remind customers if they don't have a mask, we'll remind them to please wear one. And it's actually interesting. I just saw some statistics this morning. I think we're at over 92% of our passengers are now wearing a mask when they are using our transit system. So it's a very small number that are still not, and we are only 1 week in from the new rule. So as we go forward, I think more and more passengers will adopt that, and it will make our system safer as we go along.
Thank you.
Okay. Now, other than that, one of the things that I do want to remind everybody, and this is not just for transit, I think it's for anyone, anywhere. I think under COVID, a lot of people have a lot of stress. Our situation all changed. We have been stuck at home. Some of us are a little bit luckier that we might be able to go out and buy something and things like that. So there are a lot of emotions involved. So I think what I would like to remind everybody, especially when you're on transit, please be patient. The buses might be running later, or the bus might be full when it gets to your stop. But when they are full, what they will do is the driver will inform our control system to let them know, I just bypassed the station because my bus is full. And the supervisors will make arrangement to either have a look at the situation, whether a new bus is needed to add to the system to help alleviate, or if there's a bus coming in 5 minutes, they can look into all of that. But I think it's good to remind everybody, please be patient. And also, if you ever go on transit, and let's say you're wearing a mask, everybody's wearing a mask, but one person is not wearing a mask, please do, it's not your duty to confront them, to make them wear a mask. We have staff that can do that. And for you, it's making sure that you are safe. So when you don't feel comfortable sitting next to that person, move to another seat, or sit in another seat. Or if you're on a Skytrain system and Skytrain comes every few minutes, if you don't feel comfortable staying at that Skytrain, remove yourself from the situation. There's another Skytrain coming up in a few minutes. So these are all little options that you can consider when you use the transit system to make sure you're safe. Now, other than that, as we mentioned earlier, if you need more information, there's always our website, translink.ca, or you could call us at 604-953-3333. That's the phone number to call if you have a question about our system, if you want to find out how to get from somewhere to somewhere with transit, or if you have any comments about the service that we are providing. So you could give us a call at that phone number, and we have quite a few people picking up phones even nowadays. So please feel free to call us anytime as you need. And I do want to show one more thing. I just want to share this, especially for anyone that have any questions about using transit system. We have recently created a series of videos, and they are available on our Translink site. If you go to translink.ca, go to Access Transit programs, if you scroll down, there's a series of travel training videos that will provide information on how to use our transit system. So you could click in and you could watch these short videos. They are a minute to 2 minutes, and it talks about how to ride the bus, how to ride on Skytrain, how to buy a ticket, how to get help on the system, and things like that. And for anyone that do not use English as their prime language, there are other languages available at this website as well. So please help yourself to these resources, and we will, as we go along, we'll develop more other resources and put them make them available at this website. And that's all I have to share for today.
That was great. Thank you so much, Chris, for being.
Sorry, I took a little bit long.
No, really well done.
Thank you.
No, and we will link those other videos into the side of this presentation here. Sarah, I know that CAN's programs have started to open up recently. Have people reached out to you about using transit to be able to attend the in-person programmings that the Canucks Autism Network have started?
Yeah, so we have had a few inquiries from not only a few participants but staff as well who often rely on transit for getting to our programs. So yeah, it's certainly really important for our membership to have a better idea of what to expect when taking transit during this time.
Jake, as a person on the spectrum, as you like to be identified as, what's your take on the masks and the physical distancing limitations on the bus?
Well, I think that, it's really important, like Chris said, to be able to keep yourself safe as well as other people safe. And, but I do like the fact, and I think it's really important that there is an exemption for individuals who, whether it's, like I said, for sensory overload issues or for other health reasons, whether it's respiratory or what have you. I think it's really, I think that it's a good thing that to have those cards to be able to, and I think it's probably a good reminder at this point, to remember Dr. Bonnie Henry's words of, be kind, be calm, be safe. We can all be safe together, but we can still do so in a way that's, that's calm and that's, being understanding of the people around us, and not, because some people assume if they see someone without a mask, oh, that's a person who's just flaunting the, the rules. But it could very well be somebody who's on the spectrum, or somebody who has, COPD or something like that, or some kind of other challenge. So I think we all have to be conscious of the fact that, just as Chris said, it's not our job to police people to go and tell them, hey, you don't have a mask on, put one on. To remember that there might be a good reason for that. And so I'm glad that those cards are available so that people can say, not only to the bus drivers, but if they're confronted in a really uncomfortable situation, that they can say, this is why, I'm not just trying to avoid following the safety rules that we all have to follow. I'm just, it's what I have to do. And I think that, but I think it's very important in terms of, wearing the masks. And I'll tell you one thing personally is that for the first 8 or 9 weeks of COVID back in like March and April and May, I didn't ride the bus because of the fact that I felt really unsafe and I didn't feel like there was really a plan. And so I was really, really happy when Translink, they put the mandatory mask system in place with that exemption for people who cannot wear one. And I like, Chris, that you've confirmed it doesn't have to be, a medical mask. It can be a cloth one, it can be a scarf, it can be a, bandana or something, right? Because it's sometimes, especially for people who have sensory sensitivity, there's a specific fabric sometimes that's very difficult, it's more than uncomfortable. So, I appreciate that you made that point. But yeah, no, I just think that it's important that as we, that we have to look at people on an individual to individual basis, and not just assume that if they don't happen to be wearing a mask, that they're just that they don't care about the rules or about safety. But I really appreciate, Chris, that you've come here to give this presentation and to just, I think, give people a lot of peace of mind and a lot of clarity, maybe where there wasn't before. So thank you.
Great. Yeah, and I just want to piggyback on that comment from Jake. We at Translink, we have been trying, and actually Jake was part of this conversation before as well. We were trying to raise the awareness about precisely what they call invisible disability. There's no universal way that we can tell this person has a disability. There are so many different disability in our region. Just by looking, many of us would not know what most people have disability. We would not know that they have it. So I think it's having that awareness that there are customers on the system. They look like everybody else, but they might have different needs. So it's important to recognize that, okay, they have that different needs. They might not be able to wear a mask, and that's precisely why it's not the passenger's job to confront someone and says, no, you have to wear a mask. Now, there might be people like that on the system, and the reality is with the transit system, we serve everyone. So it's hard to say that, no, you can't come on because you are not nice. No, you can't come on because you are not wearing a mask because you can't wear a mask. So everybody is welcome on the system. What we can do is we can make sure we have everything in place to make sure ourselves are safe. So as we talked about earlier, the mask, keeping the distance when we can, remove ourselves from uncomfortable situations that we feel uncomfortable in. So those are the number of things, and also having the number 604-953-3333 available. So if anything ever happens and I need to find an alternative to take another bus, I could call and says, I'm at this location. Can you tell me how to get home? Things like that.
Yeah. There was one other question that came in from Katie, and I'm not sure who would be best to answer this question, but Chris, you said that there was, it would be better to be able to use transit when there's lower hours. But if you have a high level of anxiety, how are you supposed to know when those low hours are going to be?
Well, I guess it really depends on the trip you go on, because different areas might have different hours that are what they deem as rush hours. So for example, in Lower Mainland, we have, Jay, correct me if I'm wrong, I think we have like 200 and something bus routes in Lower Mainland. Some of them, like the 99 on Broadway, anytime you go on the bus is full. But there are bus routes maybe in the suburbs, in, let's say, the mountains in Coquitlam or in Delta by the shoreline. Their buses would have one or a few people on the bus at most of the time. But I think one way to figure that out is, especially if you live in the area, before you go on your trip, like a few days ahead of time, maybe just stand in a bus stop and have a look. How many people go on the bus? How many people are waiting? It's doing that kind of preparation, especially if you are going to take that bus. Let's say you end up going back to school and you go on that bus every single day. It's probably worthwhile to do that research for maybe one afternoon, just to figure out when is the time to do that. And then of course, maybe find out if there's other options. But I think most general idea is rush hours is in the morning from 6:30 to maybe 9:30. And then afternoon is from around 2:30 to 5:30 to 6. So those are the hours that tends to have more people on the system. But yeah, it really depends on the routes you're on and the area you live in. If you live in a high density area like Metrotown or Broadway, the buses are probably full, the Skytrain is probably full most of the time. But if you live in a suburb area like where I live, I don't even see anybody walking on the street right now. So it really depends on the location you're at.
Okay. We don't have many more questions that are coming in at this point. If people had other questions and they wanted to be able to get in contact, they can leave comments and we will forward the questions on to the appropriate people to be able to find them the response. Sarah or Jake, do you have any final questions that you have during this time?
No final questions for me, more just a comment. Say thank you so much, Chris, for providing such an informative presentation. And for anyone who is more interested to learn about some of the collaboration between Canucks Autism Network and Translink and kind of what we've done in the past and what we're hoping to be able to do creatively in the future over the next few months, don't hesitate to get in touch with me. I'd be happy to answer any questions.
And are you comfortable if we share your email there, or should people contact us? Okay.
Yeah, you're welcome to share my email.
Okay, thank you.
I just want to take the opportunity to thank Chris. A lot of work's gone into this this presentation, and I think right now, like I said, especially in a time where we're all living in anxiety and uncertainty, I think you've helped to alleviate that to for a lot of people today, and provide a lot of information that I think some people maybe weren't clear on, because I wasn't clear on a lot of information regarding Translink and what their strategy and policy would be around dealing with COVID and keeping everybody safe who rides transit. So it's been educational for me too. This process since we got started. So thank you to you, and Sarah, thank you very much. Great to see you, and Brock, thank you as always.
Thank you, Jay.
And I just want to say thank you to all of you for being great partners with us as we develop this travel training program. It's difficult to start a program like this when we don't have anything like this in Lower Mainland before. And it's thanks to the great support of groups like yourself, and there are many of you in Lower Mainland. I most definitely cannot do this job alone. I'm an army of one at Translink, but I also say that I am an army of thousands because there are thousands of organizations like yourself in Lower Mainland. So I'm so glad to be working with all of you. But I do want to add a few more things. One is if you have any questions about Handy Dart or Handy Card, you can also ask those questions right now. I can answer some of those questions as I work on the team. I do have knowledge about what we are trying to establish as a system called a family of service, where different modes becomes available for customers with different needs. So we can definitely talk about all of those. And I think it's just good to remind everybody that our system is very accessible, but we continue to look for ways to make it better. So if anybody have any suggestions or it could be that they are traveling, well, not right now, but before when they were traveling, or after when COVID is over, when you go traveling and you see a good idea, let's say in Europe or in Asia, give us a call at the 604-953-3333 number. Or if you just thought of something, let us know. There are ways to push those comments and suggestions forward. And the more you talk about it and more people talk about it, the more we can look into different suggestions like that.
Thank you, Chris. And I think that's accessibility, is being able to be willing to listen and learn and adapt and evolve and change. It's so great to be able to hear. I saw this week that there was the new double-decker buses that Translink had just bought and implemented. But so I'm really excited to use those, because I know I had used transit like that in Edinburgh when I was there. I was like, oh, this is such a great system to be able to get out to the ferry terminal and make that transit easier for everyone.
Yeah, for me, it's very different. Where I came from, Hong Kong, we have double deckers everywhere. It's the single decker that's the cool stuff for us. So when I came to Canada, it's all single deckers, and this is awesome. And now all of a sudden, of course, I'm happy to see the double deckers coming in, because for me, it's like, oh, a piece of home is coming. But then everybody is like, oh, these are like the coolest thing in the world. I'm like, we have this all over the place. So it's a very different situation. But I think it's also worth mentioning. So a lot of customers, they wait until they need to use the system to find information. I think with COVID, now is the best time to precisely look online to, or maybe pick a really quiet time, because right now there are quiet times on the transit system. Pick a quiet time and maybe practice a route. If you have never been on a bus before, this is now the time to maybe just get a ticket, get a compass card, just jump on a bus, try it out when there's less people in it, because especially if you have sensory issues and things like that, it's a good chance for you to get on it when nobody is there. Now, if that makes you, if you're comfortable with that, maybe next time try a busier time. But well, that way you could gauge yourself and do a gradual introduction to the system yourself.
Chris, do you know, this is a question from Cynthia that just came in. Do you know if there's been any discussion on making certain Skytrains for people who cannot wear masks? Is that an idea?
I'm sure there are suggestions like that all the time. I mean, different system around the world have different cars specifically for certain things. So, for example, in Asia, there are cars specifically for customers with disability, or there are cars specifically for only certain gender. But I think in Lower Mainland, we are not at that point where we're having that real big discussion yet. Part of it is because our ridership is not as big as those systems, and plus our trains are shorter because ours is more light rail system. So it's very difficult to dedicate a whole car to one group of people, because, for example, if you look at the new Skytrain, it's all the way through. You can walk all the way through. So it's very difficult to say only certain people can jump on this car. Yeah.
Okay. And do you know if there are any exemptions or additions of people being able to use the Handy Dart system if people are unable to use the bus system or feel uncomfortable due to COVID-19?
So with the Handy Dart system, it's a little bit different. With the Handy Dart system, it is something you need a medical verification. So you can actually go on our website at translink.ca, or just go online and type Handy Dart Handy Cart application. You can download the application form, fill out what you need, and then bring it to a medical professional. Now, when we say medical professional, it doesn't have to be a doctor. It can be somebody with medical credentials that can verify, but they have to explain why you cannot use the regular transit system. So that could be that I can't walk that far, or I can't stand, I have balancing issue and things like that. So once you're able to do that, then they put it into the application process. So, but we also recognize that there are limitations right now with customers going to the doctors because of COVID. So what we offer to do now is if you can't get to the doctor, you can let us know. We can give you temporary or status for Handy Dart. Or if you let us know who your doctor is, we can contact your doctor directly, and they could give us an assessment. But so Handy Dart is a little bit different. I know a lot of people actually think Handy Dart is for seniors. It actually has nothing to do with seniors. It has to do with your ability to use regular transit. And even on Handy Dart, you still have to wear a mask, because I think it's actually a great understanding that for Handy Dart customers, a lot of them have weakened immune system. So it's much prefer that they wear a mask because it might be that they might get infected, or they might pass it to somebody else.
Okay, thank you for that answer. That is all the time that we have for today. We will share this video and leave the video here. If there are other comments that are coming up, I want to thank everyone again for their time. Stay safe, everyone.
Thanks, everyone.
Thank you. Yeah.